Okay, I think we get started. There might be other people joining in progress. Well, welcome everybody. Before I begin, I'd like to begin by acknowledging and paying my respects to the traditional custodians of the land on which we gather today, each on possibly different lands, and equally pay my respect to their elders past, present, and emerging. Should there be anybody of Aboriginal and Torres Strait Islander heritage, we welcome you and also pay all my respect to your elders, past, present, and emerging. This is our first inaugural sort of career webinar or panel, becoming a webinar due to COVID restrictions. It came as a result of, I guess, being contacted by people over time in terms of sort of keeping the contact and the lines open between this degree and what comes after the degree. And I'm happy that we managed to get 3 of our graduates together to share a little bit of their experience. As for the proceedings, look, feel free to turn your cameras on. It's usually nicer to talk to someone's video than to someone's name printed on black background. And the way we envision this is that, clearly our panelists who have hopefully been properly introduced in the announcements, and they will probably say a little bit more about themselves as they go through their short introductory presentations. But we have thought each of them does a little of intro about their journeys in health communication and life after, career highlights, career lowlights, and projects have been involved with, and how that all hangs together with this particular degree, which, as you may know, is still pretty unique in this country. There's only really one Master of Health Communication in Australia. There are quite a few health promotion courses, usually in public health. After these announcements, we'll open it up for hopefully sufficient Q&A, and I'm hoping you come with questions, because that's the purpose of these meetings, to have this engagement and get questions answered that I suppose your teachers cannot all answer adequately in the same way. The way we would hope you do that is, look, you can raise a virtual hand. If you've never been to Zoom, it's under reactions. There's this little hand sign. So we can easily see those. Or if you do not want to speak right away, you can type them and I can read them out. If you do want to talk to a particular panelist specifically, and you type your question, of course, you would have to add the name to the typed comment. Other than that, that's all my introduction. This is really not about the class itself. So I'll hand it over to our panelists at this point. Whatever order you have chosen.
So I think that we'll just give a quick round of who we are, and then we'll give a little bit of background. So just first up, my name's Clare Davies. I am a VP, or you could see Senior Account Director at Weber Shandwick. And I'm also a PhD candidate at UCID, but I'll give you a little bit of background more about me after Michaela and Kayla.
I'll jump in. I'm Michaela Porter. I am an account manager in the health team at Weber Communications, which is a global communications agency, but I'm based here in the Sydney office. And I'll let Kayla introduce herself as well.
Hi everyone, my name's Kayla Behay. I'm an account executive at Q Public Relations, and I've been there for about just over a year now.
Cool. Kayla, did you want to kick off on a bit about you, or otherwise I'm happy to?
Yeah, sure. So I'll just give you a little update about me and who I am. So I finished the Masters of Health Communications in July last year. And my background before that was I was at UNSW and I did a Bachelor of Psychology and Arts. So my passion is in the mental health space. And I was really interested in finding a way to combine mental health and mental health literacy, and also my major in the arts is the performing arts. So I love performing. I do acting here and there. So it was a way of collaborating those two concepts. I couldn't find a way to do it. And I really wanted to be a psychologist, and I started on that trajectory, and then I found it too clinical, and I wanted a way to kind of showcase my creativity. So I took some time off, and then I stumbled across this health communications program, and it kind of all went from there. So I was doing that, and I didn't really know what I was going into, but the more I was involved in the program, I wanted to find out more, and I realized it was the industry I wanted to be in. So I did a couple of internships. I was at the public health unit, and I did some social media there. And then I did a little stint at Headspace. I was part of their youth reference group. So I knew I was really into like mental health literacy and patient advocacy and community-based programs. And then I actually reached out to OLAF to ask about an internship opportunity because I wasn't really sure what full-time work would look like, or what an agency, what that was. And then I interviewed for the internship at Cube, and I've been there ever since. So that's me. I did the graduate program for just under a year. I was an intern for 6 months, and then I did the graduate program, and I'm now an account executive. So I'll hand it over to Michaela.
Thanks. Yeah, I guess my journey into health communications is a little bit different in that I actually came out of high school loving the science, and actually went into an undergraduate science degree, and came out with a double major in molecular biology and genetics, and then nutrition and metabolism, which is basically to say I did a lot of biochemistry. I loved the degree, but just didn't really see myself in that kind of lab environment or going down the research pathway. A lot of my other friends from the course went into, postgraduate degrees in, other health fields or allied health fields, pharmacy and things like that, but I just couldn't really see myself sitting in any of those. So had a little bit of a break, worked for a bit, and then ended up stumbling upon the Masters of Health Communication. And it was actually a friend of mine who did communications undergraduate at Sydney that put me onto it in the first place, because she had an interest in health. And I stumbled upon it and thought, fabulous, something that combines, my love of health without going too much down that research route or into the clinical practice route. So stumbled upon the Masters and really enjoyed my time there. And in terms of my experience outside of the course, like Kayla, I did some internships. I worked at the National Breast Cancer Foundation with the communications team there, which was amazing experience to see kind of the advocacy side of things. And then my first job, kind of while I was still completing the degree, I worked part-time in a public health unit like Kayla, and worked on some communications programs with them as well. And then as I was finishing up my degree, I was looking for some more full-time work opportunities. And I stumbled upon, similar to Kayla as well, a graduate program with a specialised health communications agency. And up until then, I didn't even realise that health comms agency was a thing. I'd done this Masters of Health Comms degree and sort of understood, I guess, the government side of things, and from my internship, the role that it plays in advocacy. But this was my first experience of this crazy world of health comms from an agency side. So I worked my way up there from a graduate role, and then came over about almost 2 years ago now into We Communications, my current role as an account manager now in health, and I absolutely love it. It's opened up this whole new world for me, and I'm sure we'll talk about a bit more about our experience, but I might just leave it there and pass on to Claire to talk about hers.
Gosh, two very impressive journeys. So yes, I'm at Weber Shandwick. There I am part of the senior team member there, where I do focus on driving strategic communications programs across our health and medical clients. So I've always had an interest in health. I did do a Bachelor of Communications, and whilst I don't have a science background, I was very fortunate to have an opportunity given to me while I was doing my undergrad by one of the leaders at a healthcare agency, who said, come along and see what it's like before you go into anything else. I think you'll really like health communications. And that really set off my career. So I did that. I've always worked in either independent or multinational communications agencies. I was in a conversation with a dear friend who heads up another communications agency that said you should really do this Masters of Health Communications course. So I went on to do that. And I guess working in healthcare, you're always really eager to see how you can help impact health literacy, especially across locally, but then potentially internationally as well. So I can't remember when I finished the course, but I've now have my place with Weber Shandwick, and I'm also a PhD candidate with the University of Sydney, where I'm looking into how new technologies are potentially shaping the way that women are making their food choices. So it is a very rich area of discussion, and also education as well within the university and career progression. Did we want to, I might just kick off as well about a bit about what we do, because whilst we might all be at, I guess from an agency side, I think we all have very different client work as well. So kicking off that, over the course of my career, I've worked across numerous different healthcare areas, and that includes oncology, ophthalmology, neurology, lots of ology you get quite used to. And if anything, you get quite used to the acronyms in healthcare. I think we just make an acronym for anything. Vaccines and reproductive health. I find that within a lot of the work that I'm doing as well, you're looking to try find the right balance in a lot of the communications programs you're implementing, and that's finding the right balance between the client work that you're doing, as well as juggling the expectations and the objectives of not-for-profits and third parties. So I've been very fortunate to work with the likes of the Garvan Institute, the Doherty Institute, UNSW, and the University of Melbourne in delivering a lot of my communications programs. In saying that, whilst I am working at Weber Shandwick, I've also been afforded the opportunities to currently be on a secondment. And so the secondment is working with the largest genomics sequencing company in the world, which is really, really exciting. It's an opportunity where I am leading all external communications for the Asia Pacific and Japan region. So I've been very fortunate to have that through Weber Shandwick. As an example of the work that we do, so we announced the National COVID-19 Tracking System last year, which is probably the largest earned media relations program that I have seen the largest results really. As we know, there is quite a shrinking media landscape. So I think you really get to see the value of a solid health communications package. So there we found that genomics can, and people didn't know before COVID, it can reveal information that would otherwise be missed. And that included the rapid insights into the behaviour, spread and evolution of COVID-19. And so on behalf of the client that I'm on the secondment with, which is Illumina, we worked in collaboration with the University of Melbourne, the University of New South Wales and the Doherty Institute to announce the first national implementation of the program, which was a critical step forward in Australia's pandemic response. Although I think Kayla and Michaela have some examples of how we have continued that in other areas too. So I was able to work with academics and researchers to highlight how the Australian Public Health Laboratories and Illumina were sequencing the virus were sequencing all positive cases of COVID-19 and how they were able to track that across the country. We were able to work really closely with Channel 9, Sydney Morning Herald and The Age in developing quite a complex story into more digestible information for the Australian public to understand, but then also to understand the importance of such a program within Australia. So that was quite a milestone campaign for us to work on last year. And I think Kayla actually has quite an impressive case study herself that she's working on in relation to COVID.
Yes, so I will give you a little spiel on Cube, and then I'll kind of talk to that example that Claire just mentioned. So Cube is a very small boutique agency. There's probably 8 of us, and we're heavily a senior team, but we've got a lot more juniors now, and we've got a lot more we've got freelancers, and we kind of all have different specialties. So some of us have come from a science background, some of us have come from purely comms background, and then we've got some digital experts, and we've got some senior freelancers who've been in the industry for years and years. So it's really cool for someone coming into the industry that's in an agency that's so small, because you really have to stretch yourself, and you really get to work with, like, I'm working with my managing director every day, and I'm really fortunate to be able to start my career doing that, because you learn so much from doing that. So some of the areas we work in most areas of health. I'm sure if you were to pick an area of health, someone in our agency has done it, has experience in it, but we particularly work in oncology. I work a lot in breast cancer and melanoma, the melanoma space. I'm running a project now I can speak to, and that's really interesting. I'm working in the vaccination space at the moment. We also work in diabetes, gene therapy, medical devices. So it's a broad range of areas. We also work for non-for-profit organisations as well. So that includes MS. We work with MS and a breast cancer foundation, which is something I'm really passionate about. And we've also just started working in mental health, which is my jam. So I'm looking forward to kind of watch that grow and watch more agencies like us kind of flourish in that space. So I'll speak to that case study that Claire mentioned. So I'm currently working as part of the media relations team for an Australian vaccine candidate. And that's really exciting because as we all know, the landscape is evolving daily. And to be at the forefront of something that is just, it hasn't happened in our lifetime is pretty incredible. So a part of my role in that is purely dealing with the media, and that wasn't really my strong suit coming out of the Masters of Health Communications. So I would probably recommend people to have a good understanding of the media landscape because that's something I've really learned in this project. And basically we work with the client and we work with a government relations body to build the communication materials and the communication cascade for the important milestones that the vaccination faces, any clinical trial data, and the rollout of the vaccine. So I've been learning a lot. And in terms of my role, because I'm the junior in that team, I am watching the landscape daily. I have to report coverage to the client. We have to come up with scenario planning in terms of whatever's happened. So it's very proactive and reactive. So you have to be quite agile, and you're developing really strong relationships with the media to produce interesting stories. So we've had some stories go to the ABC, go to the Today Show, Sydney Morning Herald. So that's been a really exciting project and probably my career highlight as well.
I might follow your lead, Kayla, and just kind of copy your format that you've laid out for us, which is really nice. Thanks for that. Sort of COVID related, I guess, but not really. I can talk about a client, but I might just give you a bit more of an idea about kind of what I'm doing at We Communications. So similar to Kayla, we work across a whole, we say head to toe of disease areas. I think that's something that working in health communications exposes you to, is literally having to become an expert in 101 different disease areas. But that's sort of something that I really like about it. And I think coming from a science background, I love getting into the research around, you know, these disease areas and what's groundbreaking, what's the conversation from a health communications point of view, not only what's happening in the public, sort of in our mainstream media, but then also this whole world of medical and trade media that I didn't even know about until I landed in the health comm space on the agency side of things. So that opens up a whole nother world entirely. But yeah, something that I can talk about in terms of kind of COVID related, I guess, obviously we've seen a drastic uptake in telehealth, and there's been a lot of discussion being made both in government circles and in public discourse around, you know, the growth of digital health and what that's going to mean in terms of transforming our healthcare system and also helping to reduce, obviously, the burden of various diseases that are very prevalent in Australia. And one of the clients that I work really closely with, they're essentially a digital health accelerator. So they help upcoming digital health companies in Australia grow and what we call commercialize, which means make it big, basically, make it to a commercial product. And they work across everything from apps that support children with seizures, for example, or there's what we call remote monitoring of people with diabetes. So instead of having to come regularly in to see their clinician in person, they're monitored remotely via, you know, sensors that they use that are then connected to their mobile devices, for example. So it's this whole other world of kind of digitally powered healthcare that's just waiting to be tapped into. And this organisation, like I said, helps support up and coming companies in the space. And they wanted to really drive a renewed discussion around digital health and what the future of digital health in Australia looks like. And it was actually very timely that we were brought on board just before COVID hit. And this discussion around telehealth really took off. So we helped them drive some really important discussion around what's happening in the space. When we had budget announcements related to telehealth investment from the government side, did a lot of work around that. A lot of what we call thought leadership, which is really, you know, getting pieces where key opinion leaders drive discussion around these important topics. So feature our client in coverage across, you know, top tiers like the AFR and the Australian and things like that, talking about these really important topics. And it showed really the impact of communications in terms of creating change within government, because we're now actually to the point now with that client where they've become a critical stakeholder in those government conversations in terms of, okay, where do we need to invest budget in order to make this happen in Australia? So that's really exciting in terms of talking about, you know, real tangible outcomes that getting media can have in terms of, you know, not only driving conversation and getting that coverage, but really actually making differences for people, and the impact that can have is, you know, astronomical. So yeah, that's just an example that sort of ties into COVID and talks a bit about digital health, which is something that's a bit left field and something new that I've ventured into in my time here at WE. So that's something that I'm really proud of and something that I'm enjoying, and it's certainly opened up a whole bunch of work around digital health now. So that's kind of become a new niche for me. So yeah, that's just one example. I don't know if you have something else you want to talk to, Claire.
Well, I think it's interesting about the role of digital health and social media, because I think even before COVID that I thought I knew quite a lot about digital and social media in healthcare, but it's just changed so much that, and I think it continuously changes. And I think it was interesting to hear your perspective about the thought leadership pieces, because whilst at Weber Shandwick we have teams working across various different disciplines or categories, you know, so consumer or tech or retail, the role of thought leadership, particularly in healthcare and driving a lot of those discussions and relationships with government is critical, especially Kayla, who was at a lunch today with the I think the opposition. The opposition.
Yeah, it was a post budget lunch.
Yeah.
The opposition, the health minister. So
yeah.
That was great.
Very impressive. But on digital health, though, what we've have done for the last couple of years, and it's Definitely progress in, and I guess our type of work that we do, because if we're not doing this for a sole client, we're actually doing this, we're actually implementing risk mitigation programs that are associated to a program, that there might actually be a discussion fueling online, or one that we might have a social media campaign, and hence why we need a response strategy in place when we have certain types of groups or people asking questions. So it might have even launched just before COVID, but we ramped up during COVID. We worked with a large pharmaceutical company, a vaccine company, not related to COVID, but it was in meningitis. And so what we did working across our different offices across the world is developing a risk mitigation strategy where we were able to identify various groups that might have a negative sentiment or negative opinion towards our campaign, that was really seeking just to drive parents to go and talk to their GPs about vaccines and about their children's health. So working with them, we developed a response strategy. So our teams were trained to assess any comments that came through, assess those ones that really warranted, because we do understand that digital and social media still very much provide us as an opportunity to engage in open dialogue with families who are seeking information about vaccines, but then also identifying those where we actually need to detect misinformation and also find a way to dispel some myths about meningitis and vaccines. So we worked with the company across social media platforms, from Facebook, Twitter, Instagram, YouTube, and various blogs. So those might have been opportunities that we actually just, we viewed them to maybe assess, but then once they started commenting on our platforms, we wanted to respond in the most appropriate way. So we use a response bank to monitor, respond, and build and ensure that the audiences that we were targeting were gaining the best disease awareness education that they needed, and really increase the awareness of the need to go and speak to their GPs rather than being exposed to more misinformation, because we've definitely seen the value in health education programs online in that way. Do we want to answer questions now or at the end?
Yeah,
if one pops up. Yeah.
Yeah, we could. I mean, Karen had a question. It's in the chat. It's how you define thought leaders and what qualifications do they tend to have?
Oh, good question, Karen, because I think that it would, and Michaela, correct me if I'm wrong or I'm missing one here, but I would say that depending on where the area that you're working in, so they would be considered an experienced, incredible person in that specific therapeutic area. In our cases, it's generally classified as a therapeutic area. So it might be someone with a very high qualification, whether that be a medical professional or an academic or a researcher. Otherwise, if it's within, if we're working closely with a pharmaceutical company or any organization, it would be someone in the top leadership position. And I think that's why we've seen the likes of the country head for, AstraZeneca sitting down with the 7:30 report this week. So that is where it's important for someone at the most senior level within that company to be fronting the media and answering those questions. But when it comes to qualifications, Michaela and Kayla, correct me if I'm wrong, but it really would vary across whatever area that you're working in.
Yeah, I totally agree. For each kind of, as you say, Claire, disease area or specialty, there'll obviously be defined specialists in that space. And oftentimes in Australia, they might be a very prominent Australian HCP, for example, or specialist in a particular space that's studied overseas or done research overseas or something like that, and brings their expertise that way. But also with thought leaders, we can help to create or support them. Like, for example, that digital health company I was talking about, the head of that organization is amazing. She brings a wealth of experience from kind of the product development side of things, but we were also brought on board to help support, drive her and position her as a thought leader, because she had all this fantastic industry knowledge, but the organization itself wasn't very well known. And so part of that was actually tapping into the knowledge that she had as an individual and kind of packaging that with the organization that she was representing to really help get it out there into a public audience. So I think, yes, it's about having certain qualifications, but it's also about how we get that package, I guess, out there as well to really drive those conversations. And I think at the end of the day, it's about having two things. It's about having, the qualifications and the specialty in that area, but also having a really unique point of view is the big one as well. An actual opinion on something, a take on something that someone hasn't discussed before, or a bit of a different opinion on a topical conversation. So it really, in essence, it really just depends on the specialty, I think. I don't know, Kayla, if you had any other thoughts you wanted to add.
No, I think I agreed with I was thinking about what you were saying in relation to us, like the role that we would play in that thought leadership piece is kind of, they've got the skills, they've got the materials, it's how we harness that and what channels we use, and how do we convey that and translate their knowledge into the public domain. It's all about translating that health literacy to the community, to create and penetrate those messages that they want the community to know. And as you say, it's really dependent on the specialty and the industry, so the disease area or whatever it might be. So I really think our role is about, kind of harnessing all that knowledge and channeling it in a way that's engaging for the broader community.
That's such a good point, I think, about health communications in general, and sort of our role is like taking very complex, science-rich, evidence-based information and translating it into something that is appropriate and can be understood by a variety of audiences. And sometimes, tailoring it to be a certain way for, say, HCPs to make it relevant for them, or it's packaging it up in a simple and clear way that then the general public can understand. So sort of the way we've seen COVID talked about and communicated by the government, for example, that's obviously very tricky to translate that complex science into things that are understood. And especially in an environment like COVID, where the evidence was constantly changing, you could just see the challenges that presents. But I think that's a really critical part of our role as health communicators, is really being that translator almost of the complex.
Exactly. I also think, like, particularly right now, and for people going into the industry, like everything that's going on with COVID, the fact that it's evolving and it's going to be like this for the next couple of years, right? So I think from my experience from working with different stakeholders, whether it's media, whether it's clients, whether it's government, being flexible and like patient and understanding that people are pulling all their resources. Not everyone's specialty is healthcare, right? But everyone from all different streams and all different industries are being pulled into healthcare at the moment. And we're kind of the experts in health, and that's how we're seen. So it's exciting, and it's a lot of responsibility, particularly for someone just coming into the industry. But I think it's also about being, like understanding and patient, and understand that it's not everyone's expertise, and we're all working together to try and figure it out. I don't know if that was really an answer to anything, but I think it was important to say, if you're coming into the industry, not everyone you're working with is on the same page as you in relation to translating public health messaging.
Yeah. Karen, we probably have, do you have plain language summaries, as in examples of campaigns that we've worked on where we've had to adapt complex information into more, I guess, do you use them in your work? Yeah, I think that's pretty much in everything that we do. We can probably send you some links of examples that we're allowed to share, that we've done that before, if that helps. Look, anything to help a PhD. I completely, I relate.
I think too, Karen, just one example, I don't know if it's so much a plain language summary, but we're doing a bit of work or a lot of work rather, in the mental health space at the moment. And there's a lot of guidelines that are put out there from various advocacy groups around, you know, how we can communicate about the community. And that applies to other areas too. Like I know with diabetes, there's been a big push from advocacy around talking about, you know, people living with diabetes and living with conditions and addressing, you know, issues of placing blame and all that sort of thing. So dependent on the area, I think there's quite a lot out there that's publicly available that can cover off, you know, how we communicate about specifically about different disease areas. Because obviously when we're talking about health and talking about, you know, diseases and medical conditions, it's very emotive. I mean, these are people's lives and they're impacted, and the way that we communicate about that does have to be careful and be considered. And I think, again, that's another element of working in health communications is compassion and really understanding, working with a lot of different groups and different stakeholders that are very invested in the work that they do, and obviously working with patients or people living with conditions themselves as well. So again, that's a bit of a tangent to your question, but I think there is a lot out there, particularly from the advocacy side of things, about how to appropriately communicate about topics, but also about people that live with certain conditions as well.
Christian, you have a very good question. So there we do, probably in every client that we work in, we work directly. Much of our work has to go through, we call it medical, legal, and regulatory. We have to go through lengthy processes. So if we review, and usually the steps are, we review the science, the clinical papers. We review any medical education if it's already developed in place. We put that into whatever campaigns that we are working in. We work really closely with their local teams, but we can go through up to 2 to 3 months of reviews. Everyone's like, of reviews with medical, legal, and regulatory teams here and overseas. We have to go through a process where every single statement that we make, wherever it may be externally, has to be referenced, and we have to back it up with a paper. This is where sometimes, whilst we might talk about how excited it is to be working on these campaigns, there is a lot of legwork ahead of that. When it really is in an area where maybe it is a whole new area that maybe the current team actually don't have direct experience within that therapeutic or that health condition, or that it is really, you know, far too complex for any of the current team, we would bring in a medical writer. And the medical writer is usually someone that does have a medical degree. And I'm quite sure across all three of us, we do have our go-to medical writers as well. But when it comes to a lot of the work that we do, we are in a position that we are able to develop the materials and work really closely. It can take months to get something out the door. So that's why sometimes when there is some of the misinformation that's out there, I think sometimes we get a little bit defensive because we know the length of reviews that the clients would have had to go through to share some materials too. I don't know, Michaela and Kayla, you probably know the systems I'm talking about.
I was going to say, the only thing I want to add is that I think the record for number of reviews on a piece of material I've had is 20 on a piece of material. Went back and forth 20 times with that.
Oh, I thought 14 was a lot.
Yeah, so yeah, and when we say evidence-based information, that's really what we're talking about. Yeah. I don't know, Kayla, if you have anything to add.
No, I've spent many hours processing things through review systems. It's something, if you are at a junior level, it's something that you will do quite a bit. and getting familiar with those systems is important. And I think it's a really good skill set. And it really, it makes you aware of your attention to detail and like really harnessing that skill, because you miss one thing, the client will come back and be like, this needs to be fixed, or this isn't referenced correctly, or whatever it might be. So I agree with what you guys are saying.
And it's also understanding the Medicine's Code of Conduct and the TGA, because I've been in situations where we thought that we could speed up a process, a media release that we're going to pitch out here. We gained the reference pack from our US team, but once we reviewed the references and the claims, they wouldn't be, it wouldn't adhere to the codes that we'd have to follow. So we would have to work with our teams to conduct our own literature reviews, and also keep the client on that journey as well, to ensure that, you know, it meets their requirements too. As Kayla was saying, that how much of those processes are, you know, placed at an earlier level. It's actually what I have found across my teams is that it's a good way to see if people are really committed and really interested, because some people really enjoy sitting there and reviewing the papers. Some people would like to do, you know, other things. So it's a way of seeing who's keen to stick it out, and it does become very worthwhile.
I also think, to add to that, as someone who does that quite a bit, I was working on a campaign. It was more of a cosmetic campaign, because we do lifestyle beauty as well. So it was a beauty campaign, and it was social media content, and the review process was just so lengthy. But we were also drafting that material. And I found that because I was the one going through the process of the review process, I was the one most competent and familiar with the content. So when we came back to that project later, the team were relying on me to draft that content, and I had more responsibility, and I was more sure of what I was doing because I was so familiar with that work. So I think, as you guys are saying, there are positives to sitting there reviewing the content.
Yeah, but there is times though that working on our clients usually know upfront, you know, whether or not they believe it is a medical right, and they know our teams too. So some of them would say, in this case, I'd like you to bring in a medical writer up front. And then that's usually when we bring them in. I had to do that last year when we were working on HER2 positive breast cancer, because it was a whole new treatment process. It was going to be the first, and there were going to be a lot of questions from HCPs. So we had brought in a medical writer actually in Hong Kong, because they had, not only was she qualified to do that, but she was also, she also launched it in Hong Kong as well. So she was aware of the area too.
All right, guys, keep your questions coming. I'm going to ask one because that's a question that I get a lot, depending on where a student is. And although you have introduced yourselves and your careers, here are the usual questions. What the hell is health communication? What can I do with it? And once you're in the program, how do I get started and break into the industry?
Michaela, you're going to ask?
Well, in terms of when we get asked the what is health communications question, this is like the question you get asked at a party when you say, you know, oh, I work in banking or something, like, what do you do? And then you have to explain your job, which I find very difficult. And it sort of varies from, oh, I work in communications, but it's in health. So, oh, okay, well, what does that mean? Okay, well, I do communications to HCPs, but I also kind of work in disease awareness. And so they say, oh, like public health campaigns. And I say, yes, kind of like that, but a whole bunch of other things. So I find it really hard to simply explain what our job is, let alone what health communications is. But I think we've sort of touched on a couple of key aspects in terms of translating complex health information into appropriate communications for whatever particular audience. And I think that's really important, is because the way you communicate to a patient is very different, or to the general public is very different to how you communicate to healthcare professionals, for example. So at least in the context of what I do today, that's sort of how I think about health communications. I know there's a lot of different facets of that in terms of how that fits into, like Claire mentioned, health literacy and disease awareness and health promotion, and there's all these sorts of other facets of it as well. So that's sort of my take on it. I don't know if the rest of you guys want to throw in your take.
I agree. I always say at a party, it's a mix of public health and communications.
Yeah.
But I think for me, the goal and the drive is it's everything that Michaela was saying, and then to add on to that, the end goal is to increase positive health behavioural change, right? We all know the behavioural change theories from uni, and it's seeing that in real life, seeing someone go from the stages of change, pretty much from one stage to another, and when you see that transition through the campaign that you're running or talking to a patient, that's like the most rewarding thing.
Yeah, I think that's really important. That's probably one of, aside from getting to work closely with patients and advocacy, I think that's one of the coolest things about the job, is because at the end of the day, there are some tangible outcomes that you can see there, and you are making a difference, even if it's in a small way. And I think that's what really has drawn me to the job. And I think from your perspective, I think that you're quite similar, is being able to make that change, I think, and kind of the power of communications to do that, which from the outset you wouldn't think is possible, but it actually really is. So
I might jump to Verity's question, then we can go to Alyssa's, because I think Verity's question builds on this, and it's the fact of, do you see the change? So you don't always get to see the change. And I think that's where our probably our favorite and most impactful campaigns are the ones that we are able to see the change, because it really just depends on what stage of the program that you're working on. So you could be working on the like a pre-PBS announcement, where you could work really closely with your client and various organizations to hopefully have a treatment go from $300,000 a year, where someone has had to after retirement actually go back to work just in order to pay for a treatment, or go from $300,000 to $36, and really see them be able to improve their quality of life, and and have the last couple of years of their life in good health with their families. So I think when you're able to see that from a government reimbursement, I think that's where you get to see the change in some of the various work you would do, predominantly from a stakeholder engagement point of view, and also patient advocacy. I think in other cases where it's about education and driving people towards various different behaviours, this is where we get to see more of the change due to the various different types of digital technologies that are able to show us how a specific program at a time and location, and maybe how various different consultations or prescriptions that have been filled, or treatments that have been taken from specialists, we're able to see how many more people have been able to access a treatment, and across various different groups as well. So that's where we've been able to see that change. And especially if we are also able to work really closely with patients, because sometimes the patient stories and that qualitative feedback can be a lot more rewarding to us than seeing, maybe seeing some more of the quantitative methods, because we get so deeply ingrained with these patients. I think sometimes we get on texting basis as well.
I was going to say, in terms of impact, to me, that's really what resonates with me in the stuff that we do, is the patients that we work with that are so open and honest about their story and willing to share that with the world, literally, which is always, sounds to me, it's so brave. But they're always just so grateful for the opportunity to do that and the opportunity to make a difference. And, you know, we're grateful to them for sharing their story, but to them just being involved in, you know, whether it's a video series that we're putting together or something on social that we're doing with them, or if it's more media-based work, yeah, they're always just so grateful for the opportunity, which I think is really beautiful. And, you know, not only are you potentially making a difference to the broader community, but you've actually made a difference to just that one person as well by working with them and giving that opportunity. And that's something that always stays with me, and it's you know, a really lovely part of the job.
Okay, I guess I'm going to read Elisa's question, because I don't know if everybody has the chat on. And that was it's kind of steps off of what I originally asked you guys too, since you probably went all through that at certain points. In terms of internships and first steps into the workforce, what sort of job titles or tasks are most relatable to health communication? There seems to be a lot of health promotion internships out there, but that's mostly what one finds. So what fits with this, and how would one go about it?
I think some good advice is doing a bit of desktop research around the kind of organisations that specialise in this. So whether it's, you know, agency side like us, or other, you know, even advocacy organisations or that sort of thing. Because from our point of view, we're crying out for other people like ourselves. I mean, there's just not enough people working in this kind of field in health communications, and we're desperate for interns who are looking for jobs. So if there's anybody out there who wants to put in a job, feel free to, this is a bit of a plug, but feel free to touch base on all of us on LinkedIn. But yeah, that would be my advice, is just sort of exploring the organisations that work in the space, because I know it's hard to search health communications job, and yes, a lot of health promotion jobs come up. So that would be sort of my advice in terms of finding that first step into the door. And obviously with the masters, there is the internship capstone as well, which I think all of us went through. So I did mine at National Breast Cancer Foundation, for example. Sometimes find, or often, it's a really small world. Like Kayla and Claire and I all know each other outside of just doing this event. So use those networks. If you get an internship somewhere, see how else they're connected, if they're connected to other organisations, or if people have worked there before. That's always a good way as well. It's really all about connections in this field, I think, because it is so tight and so small, but there's definitely lots of opportunities out there. So I really encourage people to go out and have a look.
I would also say that we are also looking to, so I'll give my little plug for Weber. So please get in contact. Health communications consultants are really hard to find at the moment. So there is a lot of work out there. I find your point about health communications and health promotion interesting, because it is different. I think for health communications, and particularly about the work that we all do, a lot of it sees across integrated communication. So we could be working, one day we're working with HCPs, one day working with government, another day we're working with patients. So it's a whole breadth of clients that we would have to be managing, and very different challenges every day. I think I would echo everything that Michaela mentioned. And the other point is to also look at the job description, because I think some of your tasks that you would be looking at would really spell out whether or not it is a health communications role where you'll be doing some of the tasks that we have just been mentioning, or whether you would be jumping more into health promotion and into a government role, which I think both Michaela and Kayla have direct experience in. But I think when it comes to internships and getting their foot in the door, Kayla would have the most recent experience too.
Yes. And on that note, I also just wanted to add, before I talk about my internship experience, I would also say, just from my experience, try everything. Like if you look at an organization, and like, for instance, me, I really like mental health, and I saw Headspace and I tried that for a bit. I was interested. I thought I wanted to go into government right away, and I tried that, and I thought, oh, actually, no, I don't actually want to do that right now. So I would just recommend, while you're still studying, just get as much experience and as much as exposure and meet as many people as you can, because like your journey will change. You might think you want to go down one route, and it'll change. And yeah. We're also looking for people, just going to plug Cube as well, because as everyone said, there's not that many people. It's really hard to find, and there's a really small talent of people. So definitely stay in contact with all of us and stay connected. And now to my internship experience. So what was the question? Sorry, what am I speaking to?
How do you get your foot in the door, was it?
Yeah,
for
okay.
An internship?
Yeah, so I think I mentioned it a little bit earlier, but I actually reached out to OLAF and asked, because I'd done the public health unit experience and I'd done the not-for-profit experience, and I was like, okay, what else is there? I'm almost finished my degree. I don't really know where I want to go next. And he kind of recommended me to Cube. But then I also Googled a lot of other places, because I didn't know, as part of the internship capstone unit, I didn't know where I wanted to end up. So in terms of the day-to-day, so once I'd started the internship, I was doing a lot of admin to begin, to be honest, which I think is important, because that it allows you to kind of see how an agency runs. I had no idea. I had no experience working full-time ever, or in an office job. I didn't really know what that entailed. So for me, just kind of being in a room and seeing how the day-to-day ran, simple things like, you have a meeting every morning and you take the notes as the intern, or you have to do media monitoring, which is scanning the media every day and then sending the key stories related to clients or just whatever's happening in the health space to the team. Things like that I wasn't across. Similarly, as we all mentioned, the acronyms, PBS listing, no idea what that was. The TGA, I was like, what are all these words? So learning that through the process, and just hearing my managers speak, particularly at the time that I went into the internship, it was a very senior heavy team. So but everyone was so lovely and willing to help. And then eventually I ended up going into client meetings, and then I started on client pieces, whether that's drafting briefing documents for healthcare professionals, or starting to draft a little pitch note to send to the media about a media release that was written. So you build your way up. And then by the time I was doing that for 6 months, so then by the time I was offered a graduate role, it was not a difficult transition, because I'd already been exposed to everything, and I was basically there a couple months prior. So I was really lucky in that sense. Does that answer your question?
Yeah, we got 3 more, and I'll do them in the order which I think relates best to where we were. Start with Sandrine's question, which is about whether what you've just talked about, especially the internships, are they mainly entry level, or are there opportunities and options for career changers who have some experience?
Yes. So I have seen people that have marketing backgrounds, and they're able to show that they can do the work across the different methods, whether that be PR, digital, social, corporate communications, internal communications, the last two being a very important area, especially during COVID. I've seen people that has the experience, that's been able to fall into a role in health communications, because they have shown that passion and that drive within healthcare, that they're able to adapt their work. And we've seen the value of people coming from various different backgrounds, and they can bring their learnings and their experience into how we tackle these health challenges, and some of these briefs that our clients give us as well. An example here is we had, sorry, Kayla and Michaela, but you didn't intern with me, but she was my favorite intern from OLAF. And I think Olaf and Kayla will know who I'm talking about. She's someone that had 20 years experience as a as a doctor, and so she came on as an intern. She blew us away. We tried to hire her. We would have given her a senior position. We just adored her, but she had to move overseas, and she had really no direct experience with communication, only the degree. She was very much on the practical side of things. So if it's that, yes, and as well as if you have the marketing background as well, it all comes down to your passion for healthcare, and we see any team member, any organisation will see that.
Okay, well, let's move to Michael's question, which is an interesting one. It's actually two. What is something that you wished you had done during your master's, and what is something you wish you had known about this industry?
Go, Michaela.
No, I was going to say, Kayla, you go. You're good for this one.
I was going to say, for me personally, I wish I'd done, because I was never interested in media and I was very public health focused, I wish I think I did media relations. That was the only subject I did, which was really helpful for me, but I wish I did a little bit more in that space. And also with the rise of digital health and the value of social media, it's not something that came naturally to me. So I kind of wish I did a social media type of unit, which I didn't do.
It's not so much, and I wish I did, but coming from science, I literally didn't know the first thing about communications, and I found that really hard. So I sort of split my time equally between kind of media and comm subjects and public health subjects, because I felt comfortable in public health and not in communications, and also because I was still figuring out, do I want to go down the government route? Do I want to work in more health policy? I sort of wanted to try a bit of everything. So if you're unsure, I'd sort of recommend trying a bit of everything, and definitely upskilling in your weaknesses, because that really helped me. It was challenging, communications for me, but ultimately it really gave me the skills that I needed then in the workplace. So yeah, that would just be my recommendation. If you're not sure, just try a bit of everything and see what you like. And there was another part, wasn't there?
Oh, it was what you wish you had known about the industry or the masters. Go, Michaela, answer.
No,
you
go first.
Oh, I was just going to say what I feel like I took advantage of the courses in the masters. I loved the fact that I was able to do my classes in public health. But I actually wish that I integrated myself more into the groups and the students and more into the university. I know it sounds really weird that I'm saying that now, especially being very much ingrained in the uni now, but I think that I have, for the friends that I have made and the network that I was able to build, I think there were some people that I wish, and more groups that could have been more rewarding during my my course. But some of you might very much relate on trying to juggle your masters and working full time. So, I wish I was able to maybe dive in a bit more than have to try to juggle the two, but, it was still a great experience. And what I wish I had known, what I've got used to, is the very long hours that you can end up working. We won't dance around it. You can work weekends and you can work late nights, but as from all our examples that we've given you, it's a valuable experience.
Okay, we got two other nature questions, but feel free to ask more questions about careers if you are interested. I'll start with Christian's question about whether you actively have to search for clients or whether they just approach you. Is it similar to the commercial world or is it slightly different?
Oh, sorry, I don't mean to hog the microphone, but I think I'll take that because unfortunately that's very much part of my role. Apart from now that I'm on the secondment, it's not. But before then, when you are I would say from an account director or SAM level above, you do. From an agency point of view, you have to ensure there is a very healthy bank of clients that can not only meet the expectations of the agency and the team and keep them busy and doing the work that they love to do, as well as the work in the pipeline. That can be really tricky when you do manage a team, because you want to make sure that your team's doing the work that they want to do. You have work coming in, but you also have the team that's able to do that and the work that's about to come in a few months' time as well. Depending on who you're working with, it can be very difficult in healthcare because there is actually so many conflicts that you wouldn't be quite aware of or even realize. So if we're working in one area of breast cancer and I'm working on a certain treatment that could also be used in another condition, then we would be cancelled out. We wouldn't be able to work with that client. So we have to be really strategic on who we work with and who we search for new clients, how we approach them, and what's our point of view and what we could bring to them, and then how we can respond to their briefs and make it, and respond to the briefs in a way that doesn't fully, break the team, but gets us the work.
Okay, does anyone want to add to that?
I think you summarized it really well, Claire. I think it kind of ties into the long hours thing as well. I think I don't know about other industries, but certainly in our work, it sort of comes in really intense periods and then it will die off. Like it's very peak and trough, basically. And I think it does make it really hard in terms of focusing on pipeline and being able to manage that with the work you have on right now, because you might be slammed this week and then have nothing on next week, but then a client comes and wants something done tomorrow that really should take 3 weeks to prepare for. It's a pretty common scenario. So it is a difficult balance, but of course there's always the odd kind of dream client that just lands in your lap sometimes that you get to jump on. And there's also clients that come back after you haven't heard from them in 4 years, or that particular client in that job role that you were working with a couple of years ago has moved to another position and they remember you and come back again. So it's a real mix, real mixed bag in terms of new business and driving that from a client side of things.
Okay, I guess we'll take Verity's question then, which is probably an opinion question for each of you and your employers. The idea about the current COVID vaccination uptake and how would you convince hesitant people to get the vax?
I really have to watch myself when I answer this question. It's an interesting area. One of my closest friends is the communications director for one of the vaccine suppliers. So she was the one that was actually at the 7:30 report with AMD the other night. I think it is, I do watch, yes, and I do roll my eyes, and I roll my eyes even in front of people if they're like that too. It's hard to watch. I have a 77-year-old father who very much needs the vaccine and was never an anti-vaxxer, and he's still very worried about getting the vaccine. And I think sometimes the messages are very much changing in what they're accepting about why they should get the vaccine. Because he travels for 6 months of the year, he sees it as, oh, if I get the vaccine, do you think I'll get to go overseas faster? And it's not well, no, I had a friend that had COVID and there's all these issues that might actually happen to her later on in life. So, or that the fact that anything can happen during this current pandemic, only you're worried about when you would travel. And when you see some of the information that's coming through to the media, do ask where his sources are. what types of media he is watching. And also I started talking about the clinical trials. And that I would be very surprised if the TGA and the Department of Health was able to launch and distribute vaccine that was going to cause as much issues as what they are hearing. But that's a conversation I will have with select people. I also have to be very careful of who I speak to about that too, because some people have very much changed their opinion about vaccines. And I think sometimes with that, it's much deeper than what I can offer, what I can offer in these situations. But yeah, I always go back to clinical trials.
Yeah, I guess, I mean, as like if you had to, through work, build the campaign, like if you were...
Yeah.
Yeah.
So which is very much Kayla as well for what she's had to do.
So I think in terms of what we're doing, the goal is just to ensure that everything that we put out or that the journalist puts out is 100% accurate. So the only role that we can really play is ensuring that that messaging is correct and the right information is going out. So in terms of changing people's opinion, as Claire says, it's tough. You sit there and you roll your eyes and you can't understand why someone would think so differently to you. But I guess it comes back to, once again, the health theories, right? Like what motivates people to think a certain way? Can we address those areas? If for your dad, if the reason that he goes and gets vaccinated is so he can travel, if he's going to make that proactive behavioral change, so be it. So I think it just, from us, it's just making sure that messaging is accurate.
It must be a bit like herding cats, because I know that I heard on the ABC this morning somebody reporting from South Australia where the numbers are 1 in 100,000 getting a clot from AstraZeneca, because there's a smaller number of people there. So there's a smaller, number of people who've been vaccinated, and they're talking about their stats versus, stats that might be nationwide. So, wow, how you keep it under control. I'm in awe, really, and admiration. Yeah.
It's a learning experience. No, it's great. It's a massive learning experience for me, and yeah, it's exciting, but also frustrating at times.
Can we get a question from Lindsay here? I'm not sure if you can answer that, but we'll try, because it's about suggestions for international students who want to land a job here in Australia in the health comm field.
Michaela, I'll let you if you like. Oh, if you can, otherwise I can.
Did you say Kayla or Michaela?
Michaela. I need to hold on my M.
I mean, I don't know specifically about the health comms field, except in relation to international students. Obviously, there's a much bigger, I guess, market for health comms, particularly in the UK, and you'll find that a lot of people you work with in health comms are from the UK. Just because, the size of the market over there, I guess, is quite large. In terms of international students, I can't speak specifically to the health comms field, but here at we've got quite a number of students and individuals that have come from overseas and have either picked up internships or, because we're a global agency, have come from our global agency and have ended up staying here for much longer than they thought they would. So I think there are lots of opportunities out there in terms of international students. I don't know, Claire, you have anything to add from your experience around that?
So can I just check, is Lindsay, or is the question based on the student being here in Australia, or they're conducting the course remotely and wanting to do gain a job here, because everyone's so remote now? I think if you are in Australia, then I don't think there's any issues in terms of trying to land a job. If you've got the skills, and going back to if you've got the passion, then you have just as much opportunity than anyone else. So I would follow the same suggestions as what Michaela and Kayla mentioned before. I think you're overseas, you can still do that as well. Like a lot of people are conducting their internships remotely. It's just how well the internship program is developed to support and to support your needs as you work overseas too. Agents like Weber and We Communications have their global footprint, so they're able to tap into their various different offices. But then you've got the one-on-one opportunities with independents as well. So yeah, if you're in Sydney, I do think that you have the same, the same opportunities as anyone else. If you have those, you shouldn't see yourself as an international. You're very much here in Australia.
All right, good. I believe that answered the question. I think she said, yeah. I was initially thinking that whether that also has to do with whether the companies would sponsor a student who wants to work full-time, visa related, because that would become an issue if it's no longer just an internship, but an ongoing job. In just for my own edification, is that something that that your companies do?
I actually was asked that on campus the other day. And so I said that just like with any other role, what I would do during an internship is really demonstrate how the company wouldn't be able to, or the team wouldn't be able to run without me. Because that's exactly the information that the company has to provide the visa, in order for you to be awarded a sponsorship. The company needs to prove why the team and the account can't run without you, and that there's no one else currently in Australia that can do that as well. So they do that, but it's in order for it's being able to provide that evidence.
Okay, we have a nice example. Sorry, it's not health comms, but there's we have multidisciplinary teams here as well. Someone in our corporate team was at We for an internship when they were an international student about 5 years ago, and they've now come back at an account director level. Now they've just moved to Australia and have taken up a position. So it's definitely possible to have that internship. Could have a long gap between, but it's always good to get your foot in the door that way. Definitely a possibility.
Okay, well, we'll add Verity's question then. Do you have a dream job in the field?
Kayla, you can go.
Well, thank you, Claire. I would probably, for me, I would say maybe specifically, maybe being a program coordinator or the head of comms at a mental health not-for-profit, or working at maybe New South Wales Health in a mental health context is probably where I'd want to end up. But as you say, I think I'm very happy with what I'm doing at the moment. So just kind of seeing where my career takes me and what opportunities arise.
I'm sort of like you, Kayla. I mean, I started off thinking that government was all I wanted to do, and then I did government for a while and decided maybe it's not what I want to do. And then some days I see amazing things that are being put out by some organisations. Like I really think highly of Vic Health, for example. And I think, gosh, it would be amazing to work for them. So it changes all the time. But I think ultimately something in that government space or even advocacy space. But then also I've gotten into digital health, so maybe digital health. So I'm not sure. It changes all the time.
I'm in a difficult position. So I, with the work, the con that I'm on, I'm actually in the dream job that I once thought that I wanted, which is to be head of external communications for a region. And we're a really amazing company. But I don't see that in the long run. It's never been, it was my dream job before I went into my PhD. So I don't know, all I do now is just to dream about when I can do my PhD and finish it. So so it's maybe a job that I could do both, which I'm still struggling to see how that that can happen. But when you love something so much, the long days don't seem so long anymore.
Thank you. Does anybody else have a question, everybody? I don't want to hold you any longer than needs to be on a Friday afternoon. Great. Look, let me just conclude this then with just some quick comment. We're fairly fortunate, I guess, that we are just like a family. You know, the degree is not huge, but it's big enough and it's growing, which is a nice sign. But being in that position affords us the opportunity to not just have events like these, but to also stay connected and grow what I truly believe is a very valuable job to do. And I think you heard the speakers of why that is. And you know, my own career also took some twists and turns, and I come from a marketing background, completely just selling you particular products, you know, commercial products. And I guess I was pretty good at it, but there is always a void that you ask yourself, you know, what difference does it make that somebody, you know, buys a particular brand in the long run? But to have a little bit in influencing people's health, you know, is a valuable field. And so I plan to keep this program in a way that there is a constant flow between those who are interested to come into it, those are in it at the moment, and those that have left it. So we try to keep this line of communication open and, you know, continue these conversations with each other. Thanks for attending. If you did like this event, please let us know. We're certainly we're happy to, you know, run another one in due time for people that are interested in these things. You already have heard that you can contact everyone individually for whatever your questions are or requests for internships. If you do need contact information from anyone, certainly can come to me. And it goes without saying that if you do have a question about anything that I can address, I will do so as well. You just make an appointment. So thank you very much. Thanks for attending. I'll make sure I'll thank my speakers separately again. And I wish you all a good evening and a good weekend, and we'll see each other soon. Bye-bye, everybody.
Thank you. Bye.
Thanks, guys.
Thank you.